Hello, I am Dr. Basil Anwar from Bangladesh. I am a long-term vitreoretina fellow. This is a case of silicone oil removal. I am going to discuss about my struggles and difficulties that I have faced while doing the surgery. At first, I am trying to make a sclerotomy port. See here, I am checking for the position of the trocar. I want the trocar, the bevel part of the trocar, to be downwards. So I'm checking and rotating the trocar frequently, and I have started to go inside, but I couldn't. It just came out and there is some bleeding. The reason I will tell you at the end of the surgery. Finally, I was able to perform the sclerotomy port. Now I'm checking the infusion cannula and remove all the air from inside. Now it is introduced inside the eye, and I can see the hair of the cannula with the light probe. And I'm going for the second port. It's a phakic patient, so I've taken the measurement from 4 mm from the limbus, and I'm struggling to get in, but by rotating the trocar, I was able to perform the sclerotomy. Now I'm going in with the light probe to check if the retina is attached. Before removing the silicone oil, I must do this maneuver as a precaution. I can see a oil bubble, maybe a PF cell bubble in the posterior pole, but the rest of the retina looks attached. It's okay. Now I will proceed for silicone oil removal, and in the foot switch I'll go to the highest position, and my machine is in oil extraction mode. See, on the left hand side I am constantly keeping my finger on the globe to feel the stability of the globe. While removing silicone oil, the globe may sometimes get collapsed, so I'm checking the stability of the globe with my left finger. We don't want to collapse the globe, so carefully I'm removing the oil and checking the stability, and simultaneously I'm moving my eyes out of the microscope eyepiece to check the cannula and the syringe, whether the oil is coming out well or not. You can see some oil bubbles in the vitreous cavity. Here I am moving the needle in various directions of the eye so that I can remove the oil from all quadrants of the eye. This is very important. And now I have cleared the cannula and the needle and going again inside the eye to remove the residual part of the oil. We should take some time while removing the silicone oil because we don't want to keep any residual oil inside of the eye. You can also move the tip of the cannula towards different quadrants of the eye to remove the oil from different quadrants. You can see the big oil bubble that I was not able to remove from behind the lens. So my mentor came in, and as you can see, he is putting the tip of the cannula upwards close to the posterior capsule of the lens, and finally he was able to remove the oil globule. As a beginner, I was a bit hesitant to go behind the lens capsule and remove the oil because it could have been touched the posterior capsule and rupture it. Now a final check is being done. The retina seems well attached. Now my mentor is trying to remove any residual microbubbles from the eye by shaking the eye with a backflash or flute needle. Now I have started to close the sclerotomy ports. While closing the ports, you should not take the bite too superficial because it will catch the Tenon's capsule, not the sclera. And you should not go too deep because it will go through the sclera and injure the retina. Now let's see if the port has closed or not. No, it has not, because there is a collection just underneath the conjunctiva. Now I am making a peritomy to see the integrity of the port. It seemed to me like it has closed, but actually it hasn't. I'll deal with that later. Now I am closing the infusion port. Let's see how it goes. Okay, it seems closed. The struggles I faced here while doing the sclerotomy at the first place and closing the ports in the end is the tenon capsule. This was a young patient, so she had very thick tenon capsule that caused me these problems. Now my mentor is putting another suture in those ports. So this is a lesson learned that in young patients we should do peritomy and tenotomy while doing sclerotomies and while closing the ports. Thus we can be successful. Now he's checking the port. It seems okay, but the first port was not closed very well. Now he is doing an AC reformation. Now he is giving another suture in this port to seal it properly. So that was the end of the case. Thank you for watching, and please subscribe to my channel for more.